posterior lamellar keratoplasty. I am going to restrict myself only for donor dissection and insertion. So I am not going to talk about the other indications and other things. So to equip yourself to start this surgery, the instruments are not only the instruments are required, you have to practice also with the eye bank eyes several times so that to get the proper depth of the dissection, and also you have to select a proper donor tissue. So initially better you go for excellent quality donor tissue with good endothelial counts and morphology. Later you can start using the rest of the corneas as such. Like then when you are going for a dissection, it's very important that it's running now. It's running. It's not showing here. Okay, now you should get a good peripheral rim of the sclera, and also you have to remove all the T-nodes tissue from the thing, so that when you are fixing it with on the anterior chamber, it should be snugly fitting and should get a good IOP in the pressure in the anterior chamber. So here you can use the air bubble as the reflex from which you can assess the depth of your thickness of your graft, and you can slowly assess as you are doing in what Dr. Rishi showed in case of DALK. You can assess it and then you can go ahead with the dissection. So you can go ahead with your dissection. You can use any instrument. I prefer a slightly blunt crescent because that gives a smooth dissection up to the midline till I cross the midline. Then I use a blunt dissector. The dissection should go from limbus to limbus, so that later whatever size of the graft you cut, you will get a proper separation of the tissue. You can, for insertion, you can use either any one of the method. If you are using a smaller section, you can use one of the Busing glide. But if you are using a large section, you can go for manually just pushing technique or pull through technique. So this is before going for insertion, after the scoring, you just wash off all the viscoelastic and reform the AC with the air bubble and make sure that your section is holding. Otherwise, better you put a preformed suture. So then you can use either a taco technique with forceps, in which yes, with the taco technique you can push it, but generally I don't prefer this technique because I am quite clumsy with this technique, but I feel I lose more endothelial cells with this, but still many people are doing it very elegantly. Or you can use just a pushing technique using visco as a glide. So here you can use visco, plenty of visco over the area and place your graft with endothelial side down, and then you can push it with a 30 gauge needle. If the anterior chamber is a little bit compromised, then you can use a plastic lens glide, intraocular lens glide, and then you can push the tissue inside also. After pushing the tissue in, better you deepen the tissue with hydro and make sure that the tissue is unfolded and standing in place. If it is sliding towards your section or towards the side port, better you close that section because that area is leaking. Then you reform it with the AC, with the air bubble. So to improve attachment, at the end I just used to wait for 5 minutes, during which time I apply a few drops of glycerin over the surface so that it will get attached very fast. So on conclusion, it's quite an elegant surgery, and manual dissect itself, like you can get very good results. If you are not able to invest for higher end apparatus, then even with the manual dissection you can get good results. Thank you.
Thank you, Dr. Revathi.